How can demographic data explain life expectancy differences? Imagine walking through a neighborhood and noticing some houses last much longer than others. Just like houses, people's lifespans are shaped by many factors. Demographic data helps us understand why some groups live longer than others. It shows us how race, ethnicity, gender, where someone lives, and their income all play a role in how long they live. In the United States, the average life expectancy at birth is about 78 years. Women tend to live longer than men, with women reaching around 81 years and men about 76 years. But these numbers hide big differences among different groups. For example, Hispanic populations often live longer than non-Hispanic white and black populations. Hispanic women can live up to 84 years, and Hispanic men around 78.5 years. On the other hand, American Indian and Alaska Native populations have shorter lifespans, with men living around 66.5 years and women about 73.5 years. Race and ethnicity influence life expectancy because of genetics, health habits, access to health care, and social factors. For example, Black Americans have seen improvements in their life expectancy but still tend to live shorter lives than white Americans. This is due to differences in healthcare access, economic opportunities, and exposure to health risks. Gender differences also matter. Women generally live longer because of biological factors and lower rates of risky behaviors like smoking or working in dangerous jobs. Where someone lives within the country makes a difference too. States in the South, like Mississippi, have some of the lowest life expectancies, around 74.5 years. Meanwhile, states like Hawaii report over 81 years. These regional differences are linked to income levels, healthcare availability, and lifestyle habits. Socioeconomic status is a big factor. People with higher incomes and more education tend to live longer because they can afford better healthcare, healthier food, and safer living conditions. Those in poverty often face higher risks from heart disease, diabetes, and violence, which can shorten their lives. Recent trends show that causes of death like drug overdoses, suicides, and liver diseases are affecting some groups more than others. These issues can slow down or reverse gains in life expectancy. Conversely, reductions in deaths from COVID-19, heart disease, and cancer have helped some populations live longer. Understanding all these details helps public health officials target efforts to improve health for everyone. They can focus on providing better healthcare access in underserved communities, fighting substance abuse, and promoting healthy lifestyles. In the end, demographic data reveals that a person's race, gender, where they live, and their economic situation all influence how long they are likely to live. These factors interact in complex ways, creating the wide variety of lifespans seen across the country.